and I am not good at multitasking, but really so grateful and honored to be sharing this virtual space with you all. And again, these four really amazing leaders to talk about challenges and opportunities before us with regards to our newly arriving neighbors. And, as Stacey alluded to, importantly, identify ways that we can all be most supportive to these families, to these individuals, as they work to meet their dreams and aspirations. So this morning, we're hoping to kind of paint a little bit of a picture of how we got here. Why folks have been forced to leave their home countries, what has been the state of our housing and immigration systems locally and broadly in the US, and how that's impacted folks' experience here, as well as the organizations that are working so hard to try to meet the needs and the challenges of this moment. We've seen the headlines, right? The governor in early August declaring a state of emergency, the increasing numbers in early September, as many as 6,200 families in shelters and hotels across the state. And importantly, are estimated, half of which are estimated to be new arrivals, and the other half actually folks who have already been experiencing housing insecurity in many ways. The deployment of the National Guard to support some of the temporary housing for folks who, the deployment of the National Guard to support shelters that are not connected to existing community-based organizations, and varying levels of reaction from communities, from neo-Nazi protests to anti-immigrant support, even amongst immigrant communities, to huge outpourings actually of community support in terms of stepping up, in terms of volunteerism, in terms of, being welcoming neighbors. We have such limited time to delve into a situation that really has so many layers and nuance. So we're going to reserve as much time as we can for the conversation and Q&A. You'll find our speakers' bios in your inboxes, but to kick off our conversation, we'd love to do just a quick round of intros, maybe a minute or two, and ask each panelist to tell us a little bit about who you are, the organization you represent, and how you connect to the work we're talking about today. I'll just go in the order of my screen, if that's okay. Carolina, would you mind kicking us off?
Absolutely. Good morning, everybody. It's great to be here. My name is Carolina Trujillo, and I'm the Executive Director of Citizens In. Citizens In is an organization that serves people that are homeless, but also we work with food insecurity. We have a food pantry and a community meals program as other resources through our resource center. I'm an immigrant of Colombia. I came to this country about 25 years ago, and I can attest to how difficult it is to navigate the American system, the so-called pursuing your American dream. So I'm very interested thank you, ECCF, for putting together this conversation and this opportunity to come together and put our heads together in our collective talent to see how we can support people who are going through this journey and how we can be of use to them.
Great, thank you. Dr. Gabo?
Good morning, everyone. Such a pleasure to join this entire team of wonderful people who are looking to learn more and to see how they can make an impact. My name is Dr. Gabo, born and raised in Haiti, and my organization is the Immigrant Family Services Institute. This organization was born about my research around the long time that it takes for a new immigrant to transition into their community so that they can do well. So our mission is to really expedite the transition of new immigrants so that the parents have time to take care of their children, and their children in turn can become the wonderful citizen that we want them to be. So I am in this field, as I said, everywhere, because I believe that I was called to be in it. like I have been trying to get out of it for so many years, but every time I find myself back into it. So it's a way to say, you know what, you're not going anywhere. That's your calling. Just do what we are called to do. So again, I'm excited to share some of the updates with you about the new crisis. Thank you so much, everyone, for taking the time to join us this morning.
Thank you so much. Kelly?
Good morning. My name is Kelly Turley. I'm with the Massachusetts Coalition for the Homeless, where I serve as the Associate Director. The coalition does statewide work, but is based in Essex County in Lynn. We organize public policy initiatives around access to homelessness prevention resources, long-term housing that's affordable to the lowest income families and individuals, as well as working to protect the state's safety net, including programs like the Emergency Assistance Family Shelter Program. On the direct service side, we work with local schools, community health centers, affordable care organizations to be able to connect families and individuals with long-term housing, cash assistance, food stamp benefits, and nutritional needs as beds, other items. And that work is statewide, but it's an honor to be with everyone today and to really dive more into this topic, which we know that Massachusetts has had a housing crisis for a long time, and the intersections with new arrivals. So happy to be here today.
Sorry, unmute. Great. Thank you, Zan.
Hi, everyone. Good morning. My name is Alexandra Zan Weber. I'm the Senior Vice President and Chief Advancement Officer at the International Institute of New England. IINE is a 105-year-old immigrant and refugee serving organization, and our mission is to create opportunities for refugees and immigrants through 4 different areas of service: refugee resettlement, education, career services, and pathways to citizenship and legal services. Since 2020, our organization has tripled in size. We have 3 sites, 2 in Massachusetts, 1 in Boston, 1 in Lowell, and 1 in Manchester, New Hampshire. We serve people at this point all the way from New Bedford to Newburyport. Our work has grown just extensively over the past several years, starting with the Afghan evacuation, moving into the Ukrainian fleeing of the Russian invasion, and now welcoming thousands and thousands of arrivals, mostly from Haiti. At this point, we're on track to serve about 10,000 people this year. I love the opportunity to come together and talk with you. I think this is exactly, we have a couple of questions later on about what needs to change, what needs to happen. This is what needs to happen. People really need to get more involved, get into dialogue. We can't do this alone. It took a long time to get here, and it's going to take some time to move forward.
Great. Thank you so much. So we'll kick off with a couple individual questions, and then we'll move to group questions, and then we'll open up for the audience in terms of Q&A. So starting with Dr. Gabot, IFC has been at the forefront of this work for so many years. Can you kindly provide the audience some insight into the experience of our newly arrived neighbors? For folks from Haiti, for example, what are the drivers that have forced them to leave? And what are the different pathways they've had to take to get here? And how has IFC been able to support and accompany people through this transition?
Wonderful, wonderful. Again, thank you again for this opportunity. So quickly, I'm going to just fly with you, but at the end, we know that we will have time for Q&A, so we'll be able to, get into the details of the conversation. First of all, when you think about Haiti, think about everything that you can think or imagine to bring, some very, very negative outcome. From national disaster, you all remember the huge, massive earthquake in 2010, to political turmoil, not too long ago, the assassination of a president that is still under investigation. Then gang violence, right now, in so many parts of the city, people cannot travel. Children cannot go to school on a regular basis. Pregnant women have to deliver their babies somewhere in a corner because they cannot access hospital. So political turmoil, gang violence, lack of access to every single thing that you can think or imagine, no infrastructure. So people, in a way, are forced to leave because every single day it's a life and death situation. So basically, they started to go first through Central America because at some point, Brazil was leading the work for the World Cup, and they needed, workers. So a number of them, they found this opportunity to go through Brazil and Chile for a while. Then, work is finished. They don't need them anymore. Before you know it, they were kicked out. They could not get access to work. And that's how they started to make their journey all the way to the border. So from the border, here they are. For some of them, I would say 90% of them have been deported. Only a few have been able to make it here, even though you see that many that we are talking about, but it's not that many compared to the number of people who wanted to be here. So they really spent, they saw everything that you can imagine, traumatic experience where fathers are looking, just in front of them, of their eyes, at their children being swiped by floods of river. Moms are looking at their children, being kidnapped, being raped. I mean, you just think about anything that you can think or imagine. They went through hell before they were able to make it here. So now that they are here, in their mind, they think, okay, finally we made it here, and then things are going to be easy. And that's when they realize, no, things are not at all easy. And that's one of the reasons when we started to sit down with the families who are coming to us, we started to talk to them, we started to listen to their stories. We could feel the traumatic experience that they've gone through. We said, no matter what, we're going to fight for them. No matter what, we're going to stand with them, because at least after all of they've gone through, the least that they deserve is for us to be compassionate, for us to be present. That's the reason why IFC had to play like a real leadership role in terms of, bringing all advocates around all type of issues, even access to medical care. We have pregnant women who came here. They could not even go to the hospital because the hospital said, I don't have any provision for them. So again, for us to bring all of the advocates together to fight for them to have access to healthcare. For them, like as you heard yesterday, the new provision that the Biden administration just put around the work authorization. This is a fight that we have been leading, because even those who are here under the temporary protective status for 2 years have been waiting for a work permit so that they can go and work. Could not get that. So finally, after all the fight, the governor, we are so grateful to the governor and to all of the elected delegates who have been sending letters, writing to advocate for work authorization. The good thing is that most of the people who are here are very young and dynamic. They want to come and they want to make a difference. They want to work. So we are not talking about lazy people who are coming to just rely on government. As a matter of fact, our immigrants, they don't like to receive, help from the government. They are afraid. They think that, the government never gives anything away just for nothing. They think that at some point they will have to pay. So they want to work. They want to take care of themselves and their families. What they need is a booster. And that's one of the reasons why at IFC, we develop what we call the one-stop service center, meaning that when they come, as soon as they arrive, we have staff there to help them do the intake, help them access the MySelf benefit, DTA, and then help them with work authorization, bring employers so that they can get to work, and also help them with, building their resume, English classes, and so on and so forth. So just to give you a quick picture, because I know I have 15 seconds left, when they arrive only with an envelope in their hands, nothing else. So think about someone, we just land somewhere with an envelope, no clothes, no shoes, no point of reference in terms of where am I going to sleep? What am I going to do? So that's where our job comes to say, you know what? We know that you are here. We know that you feel lost. Our job is to help you find your way. And that's what we've been doing. So we have open offices all across the state, from the South Shore to the North Shore. We are in Worcester, we are in Somerville, in Methuen, everywhere, because we want to be there where they are. We've seen so many of them traveling, you know, on Uber when they don't have the money to come all the way to our Boston office for services. We said, no, we need to serve you where you are. So now here we are with a lot of a new development of those crises, where a lot of people are placed in hotel and shelters with now the National Guard. And that's, again, our job is to facilitate the transition between the National Guard and them, because we know whenever we talk about people in uniform, nobody wants to be close to them. So we had to bring volunteers to facilitate the conversation, to help them understand that National Guards are here to help you, not to send you back home. But a lot of things are going on. But one thing that really gives me joy is to know that we have people like you who are always asking, how can I help? What can I do? And that's what we have the hope, we have the energy that we need to really fly and over all of those mountains that are in front of us. Because at the end of the day, when we have wonderful people who want to do well, guess what? I know that the sky is going to be the limit. So let me stop here, because I just wanted to give you that, you know, overall overview, and then we will have more time for questions. Thank you so much again.
Thank you, Dr. Gabal. There really is so much. We recognize that. So again, invitation to dive deeper. Moving next to Carolina. Massachusetts is wonderfully a right to shelter state. As such, our emergency shelter system providers have been called upon to do all they can to meet the moment. As the leader of Citizens In, what have you seen as some of the challenges with how things were initially set up? And has that changed at all, or has it persisted?
So thank you, Dr. Gabal, for that spectacular recall of all the journey of people getting here. I think it's important to set some context of, you know, some of the myths that are around migration and coming to this country. So again, I'm Carolina Trujillo, and regarding our question, we are not unfamiliar to serving homeless communities. We've been providing services for homelessness, for homeless people for more than 50 years. I'm sorry, 40 years. I got distracted from a call. 40 years. Out of those, currently we have about 140 people that we're serving. Out of those 140, we have about 50 that are migrants from Haiti who are staying at a motel. So initially, we were pretty excited to help, and I think we still are, but there are some complexities with the populations that we're serving. And I think that most nonprofit organizations, it took them by surprise, not because they're homeless, but because of the amount of complexities that immigrant communities bring to the table. Not only the trauma that they have coming here, and Dr. Gabal was really good at kind of like walking us through that journey, but also the complexities of when we place these families, we still don't know to this day what the provisions of their asylum is. We don't know if they're under a parole. We don't know if they're under a TSP. We don't know. So until we know, we can't really move forward to help them with all of the additional needs that they have. Just to be brief, if you're under a parole provision, you're kind of like in limbo in a way. So you're not, you have to wait for your work permit. You have to wait for certain benefits that need to be approved by the federal government. If you're under a TPS status, you can access a work permit a little easier because they've already said that you're under a temporary protection status. So because of that, then the trajectory is a little different. You have to apply, you can go to Mass Health, you can do all these things. The problem here is that we don't want to hurt people while we're trying to help people. We don't want to go out and help them get all these things and help them get all these services from the state, as we commonly would do with people who are in our homeless shelters. Because then when they go through the immigration process, they ask you if you've received any benefit from your government. And if you have, you're not supposed to, you're not authorized. So immediately they will deny your petition for any change of status. So we have to make sure, and we're working with MERA now, thankfully, after bringing this concern, we had many conversations with the Office of Housing and Livable Communities, which is the organization that's really managing this in the state. about all our concerns and about how we have to proceed with care. Finally, they were able to hire services through Mira. Mira has been activated, and they're helping us sort out where are these people in their immigration journey. That's one thing. Second thing that we see as challenging is that some people have received their immigration appointment, but some immigration appointments are in New York and Connecticut. And as a nonprofit organization, now we have to provide services or some kind of infrastructure to be able to get these people to their immigration appointments. Somebody might say, well, why don't you just change and transfer to a closer to home office? The immigration department doesn't work like that. It's not as easy as not showing up and saying, oh, I couldn't go because I had transportation issues. So can you send me another appointment? That's not the way it commonly works. It's more of you didn't show up, we'll issue a removal order so we can remove you from the country. You're not compliant with what we're asking you to do. So it's pretty strict. The journey is strict. It's a cumbersome process. Now that Mira has stepped in, it's somewhat a really good hand that they're lending us. But from here on, and I'm pretty sure my colleagues know this, there's a longer process of applications and appointments and things that we're going to need support. And I don't think that any nonprofit has an immigration specialist on their payroll to be able to provide the support, the level of support and accompaniment that these migrants might need. So aside from all the social services issues that they have, like Dr. Gabo said, people show up with nothing. You have to start with the basic stuff. You know, we have to start allocating doctors, getting kids ready to go to school in September, you know, getting their medical clearance, getting their vaccination clearance. There's not a lot of specialty care for pediatrics. Like all of the complexities that you have with this population is present even more with people who don't even have a proper ID at some point, that you need to start by getting them a proper ID. So, you know, we're doing our best. And I know that other nonprofits are in this journey with us. We're doing our best. We're doing the best we can to serve these people with dignity and respect. Some people forget about that. And that myth that they want to come here and they want to take. 100% of our families want to go to work today. We are the ones telling them, you can't, because it's going to ruin we need to know first where you're at. We need to wait for that work opportunity. We need to wait for that work permit. But 100% of our families just want an opportunity to be able to stabilize and be self-sufficient. Like Dr. Gabo said, in our countries, we're not accustomed that the government gives us anything. There's a huge distrust of people, of services and things that come free from the government. There's no such thing as free in our countries. So it's a mentality that people seem that they forget. We don't have that mentality that we're going to get anything for free here. Somehow, somewhere, where it's going to cost us along the way. So we prefer to just do things ourselves. And I think that that's a myth that's widespread. And we just need to fight every day the good fight to make sure that we support our people, that we provide services, that we're there for them, and that we do the best we can.
Thank you, Carolina. That's actually a good segue to Alexandra and IANE, which does, you know, so much on behalf of our refugee and immigrant communities. IANE does a lot of work, but all with the lens of resettlement and ultimately integration. Can you speak to the importance of thinking beyond the immediate crisis moment and also making investments in more medium and long-term solutions? And how can we shift more of our energies to thinking about and actualizing the opportunity that's actually presented here?
Yeah, thank you so much. And that's a great question. I go on and on about how challenged and frustrated we are that we're at this point. Mostly because there's models that exist that like have practiced and gotten to the point of like really understanding how to welcome and integrate people. And there are larger scale models. We've had the basic same model at the Institute for over a century. They're not complicated. But I think the reality is the chaos of our immigration system And the lack of any integration planning really undermines the opportunity for people to successfully integrate. And Carolina was talking about this. Often people are allowed entry into the US, but with such a lack of clarity and support around their status and around any benefits they're able to receive, that it really undermines their potential to contribute immediately. And as Carolina said, that's what people want to do who are coming here. They're coming here to live a better life, to build their life. So I would say the challenge that we're having at the medium to longer term level is, and what I think is creating the crisis right now, is the state systems for immigrant support and housing support sort of coming together and for the first time. And that is also such an opportunity. But I think that the challenge of having a state that hasn't really invested in planning around either of those areas enough has gotten us to this crisis point where we just have a huge crisis in housing, and all of a sudden a huge opportunity in immigrant families coming to join us. And we're right at the intersection of that. But I think it's, maybe it's the intersection we need to be able to learn how these systems come together, how all the providers are integrated, and then move forward with much more of a resourced plan and a plan for all of the thousands of people who could come into our communities, who could join our economy if we were really smart about the way they were going to do that. Massachusetts has 2 open positions in our workforce for every 1 person. we need people. Our communities were built on our ability to welcome new people, and I really do feel like this is an opportunity, and we really shouldn't think that we can't integrate and absorb thousands of people, because we can. And that's how we were built. And like Dr. Gabo said, that's just a tiny fraction of the people who actually would like the opportunity to help create a stronger community with us. So the sort of the bigger, or the smaller details of medium to long-term planning, I really do hope. The administration is new. The Healy administration is new. We're learning a lot more about the Department of Housing and Livable Communities that has a new leader as well. We have had a state office for refugees and immigrants for many years, but in all honesty, that state's office is a collection of federal contracts that pass through to organizations like the Institute. When an administration completely turns over, they lose a lot of the understanding of some of those contracts. And then the last thing I'll say, and then we can get into more conversations and questions, is there's 3 stools to supporting this work. One is federal funding, one is state funding, and one is philanthropic funding. And none of them are designed to fully cover the costs of integration. So they have to combine and come together. And if we could just do more work in understanding how the federal and state funding combines, and then the gaps, our philanthropic community could really help leverage our services. There's a cost in our organizations to being ready. If we want people to avoid suffering, we have to be ready. That comes down to staffing. Those are just, really basic organizational costs. So I think this is just a call for more mapping and planning, while we're also learning how to work together and sort of how to get through this as a whole community.
That's great. Thank you. So Kelly, the current situation has obviously put a lot of attention to the shelter system. And there's a dangerous narrative out there painting the situation as a quote unquote migrant crisis. But what we're actually witnessing and experiencing is actually the latest iteration of a housing crisis that's existed for far too long. Can you help the audience better understand how we got here, as well as pathways forward for more sustainable solutions with respect to housing and homelessness?
Great, thank you for that question. Yeah, Massachusetts has long had a housing crisis. There's been a lot of media coverage talking about Massachusetts being a right to shelter state for families. And I think just to note that that's something that is a bit of an exaggeration, because many families who are experiencing homelessness, whether they're new arrivals or longer term Massachusetts residents, are ineligible for shelter because families have to meet strict income eligibility guidelines, couldn't have been in shelter in the past year, couldn't have been evicted from public or subsidized housing for non-payment of rent or other reasons, have to have a child under 21. The criteria goes on and on. And so the families that we're seeing in the shelter system are really just a small fraction of the total individuals and households who are experiencing homelessness here in Massachusetts. We also know that many of the families, there's varying estimates coming out from state officials, but only about a third to a half of the families in the family shelter system right now are newly arrived families that have been here for less than a month. And so that many of the families may be longer term immigrants or citizens. And there is that dangerous narrative that we're in this crisis because of new arrivals. What we're seeing is that many families are in shelter for a year and a half, 2 years. A report that came out last year from the State Housing Department showed that it was looking at the average length of stay in shelter and the minimum and maximum. There are families that are in shelter for years. There was a family that was in shelter for more than 8 years. And so that really points to the failure of helping create those pathways for families to exit shelter, to become stable, to be able to realize those dreams of really contributing and not having to be under the microscope that they are often when they are in shelter. But we see that this is not unique to Massachusetts, that having this limited right to shelter is unique to Massachusetts in some ways, but across the country, we're seeing a lack of housing that's affordable to the lowest income families and individuals. So right now, the National Low Income Housing Coalition estimates that Massachusetts has about 313,000 households who are extremely low income, at or below 30% of area median income. And we're missing 175,000 housing units that are both available and affordable to those households. So it's not surprising that we have over 6,000 families in shelter when we have that gap between the units that are available and affordable and the need. We're talking about, for extremely low income families, that would be households, if it was a household of 4, that make less than $86,000 a year. So we need to make the investments in long-term housing resources. We need to, there's been a lot of coverage in the news this week with reporting from WBUR and ProPublica on the disinvestment in state-funded public housing. So we need to preserve the units that exist while we're bringing on additional units. The state also makes deep investments, but not to scale, in housing subsidies through programs like the Mass Rental Voucher Program. And so we really need to make those investments, bring them to scale, and make sure that they're targeted to families and individuals who are experiencing homelessness, who have barriers to be able to secure those long-term housing resources. And we need to shift the conversation there, as well as to how do we make the investments in upstream homelessness prevention. There are families right now that are hanging on to their housing unit, but with some resources and support, won't have to have that traumatic experience of homelessness. And we have models that we know work, and we need to be able to revisit them and to make those policies a reality. Just to give an example, during the pandemic, this federal government made unprecedented investments in upstream homelessness prevention. At the same time, there were eviction moratoria in different communities, including in Massachusetts. And we saw that people were able to stay in place. And then as we moved out of peak pandemic, some of those policies went away, and we saw more and more families losing their housing. But if they had a relatively small infusion of funds, they would be able to stay in place. So if we're able to help households that have housing stay in place, and able to help families who are in shelter be able to secure the housing, we'll be able to move forward and really target the services and resources that are needed to support people in the long term, because we know just having a roof over your head isn't enough. And so that so much of the conversation now is how do we have the leadership at the state level to be able to have the big picture, to look not just short term, but also long term, and connect people with the resources that they need, and not just cookie cutter responses. And so we've been in this situation for a long time, but we do know most of the answers. It really is building the political will and making the deep investments to make those resources a reality.
That's great. Thank you. So now I'm going to shift to a couple of questions for the group. So feel free to, chime in whenever you feel so moved. But kind of building upon, your most recent point, Kelly, and I know a number of you have actually already spoken to this in some way, but thinking about both the immediate short term and medium long term, are there any other key opportunities or barriers that you want this audience to be aware of?
So I can start with a model that we built at IFC and that we know has the capacity to really help so many people. So we have what we call the expedited transition plan for new immigrants. Research has shown that for a new immigrant who comes to this country, all right, trying to really make it, it takes anything between 10 to 15 years for them to fully integrate into their community. So think about it. You are a parent, right? You have a child with you. The child is 5 years old. And then you are here in this country with that big dream that whatever you could not do, that your child will be able to do it. But here you are, finding yourself in a system where you have to work 2 or 3 jobs. You are never present in the household for your child. And then before you know it, they are ready to go to college. And then you don't even know them because the system in which you are working does not really provide you with any opportunity for you to invest in your children's life. So that's the reason why we decided that we want to cut down this time by at least 50%. So once someone arrives, immediate term is that they need access to basic services, whatever benefits, whatever little English class that they need to take before they can quickly get to a job, because that's basic, right? You come, you want to do something, you want to make a difference, you want to earn a living. So as soon as they arrive, we place them in English classes, we place them in computer classes as they are waiting for their work authorization. And that's the reason why we are so grateful, and we are hoping that this new action around the work authorization is going to work. Because if we can get the work authorization quick, we can get them to job quickly. Once we can get to at least the basic job that they need, the midterm is how can we get them to where they need to be? So remember, a lot of people who are here are very skilled. If you were to come and visit our office, I could introduce you to at least 3 medical doctors, among them 1 surgeon. I could introduce you to a director of a bank. I can introduce you to a couple of math teachers, French teachers, people who have really a solid, academic background, professional background. So those people need to get back in the field that they were called to be, because English, we know the language is one of the most kind of a big barrier for them. So that's the reason why the intermediate is to really invest in them so they can really get back to their field, because we are looking for teachers, we are looking for nurses everywhere, or in all of the area. People are dying for workforce, right? So if we can get them to that point where they can go back to their field, before you know it, they can get access to a very decent job and also fulfill their destiny until they get to the larger point, which is the full transition. So the barriers are, as all of my colleagues says, Son, Kelly, and Caroline, when you come, you don't have a place to live. And for you to find a place to live, it's a headache. It's like you cannot afford it. There is no provision to really accompany people to help them get to that level. And that's where we are all coming into the picture. how can we be around them, providing them with the support so that we can move them faster? So our plan that we have could move someone who is a high-skilled professional, in less than 2 years. That person can go back to be whatever that person was. However, when you have to deal with so many layers of difficulties around housing, around access, around anti-immigrant sentiment, all of those things, stop you from doing what you are supposed to do. But we know this model can work if we all come together to provide that support system to those new arrived families.
Yeah, can I add to that? I'm part of the Latino Empowerment Council through Governor Healy's administration, and I know that in in the state of Massachusetts, there's more than 100,000, almost 200,000 immigrants, undocumented immigrants in the state, right? Before, not counting the new arrivals, just the state, the numbers we had. About 70,000 of them have advanced degrees, but they are literally working other jobs. They're cleaning houses, they're mopping floors, because they don't seem to have that opportunity to be able to enact and activate their professional background, to be able to acquire a better position, to have more purchasing power, to be less dependent, and to be able to have a dignified life. So I think that with a lot of the new migrants, that is going to be the case. We have a lot of people who have skills and degrees from their countries. We need to start working on activating those degrees so they can get into the labor force, but they are well paid, that them less dependent on a system that's really not designed for them. So I think that, that's part of the puzzle of how we need to solve this, and how we can expedite work permits for people who can then activate their skill set to support the state and make it the pioneer that it's always been historically, so they can continue to support that narrative. And I think that Dr. Guilbeault was right on point with providing the basic essentials for new migrants, but also we can't forget the people who have been here for many, many years, who are also waiting for these opportunities to happen. We have a broken immigration system. We have people waiting, and that's there is a flavor of yesterday, or the day before yesterday, President Biden announced that he will provide 470,000 Venezuelan migrants their expedited work permits. That's amazing. We have to be incrementalist, right? We have to celebrate the small wins. But at the same time, there is there are a whole bunch of other people waiting, and we can't pin one population versus the other. How do we balance, or how do we measure who's having it worse? If it's the Venezuelans, if it's the Haitians, if it's the Colombians, if it's the Ukrainians, how do we measure who has it worse to pick a group that we're going to protect, and then the other ones we're going to just put on the back burner? So that's something that we also have to advocate for. If we're going to move forward with this agenda, then everybody should come as part of the agenda, not little pieces. And again, I celebrate the small wins. I don't want to not be grateful for at least that part of the community being taken care of. But there's a whole bunch of other people waiting for this opportunity, and for them to be taken care of as well. And it's a work permit. It's not even a legality status. It's a work permit. So the biggest thing that I hear from people is immigrants just want to come here and reap our system. We're asking for a work permit to work and contribute, and we can't. So again, there's a direct kind of like I have the word in Spanish in my head. Something that's a contradiction. That's a direct contradiction to what we're seeing.
Yeah, that's great. I think there is, again, just to pick up on that a little bit, again, these narratives that are potentially dangerous for all of us, right? In terms of like the language that we use and the narratives that are put out there and perpetuated in some ways, actually is not in service of all of us. We need all of each other in this, and we can't single out or pit one community against another. Alexandra or Kelly, yeah, I saw your hand, Alexandra.
Yeah, I mean, to that point, I would just sort of reflect that I've been in this work with the Institute for 15 years, and that's just like a drop in the bucket of the amount of time. There's been 400 years of inequity in welcoming people. But I would say there's, at the federal level, the immigration is a geopolitical tool and process. And, I think there's so many other layers to why there's so many inequities, and they're complex. And I think for us, it does end up feeling very overwhelming, that we're at the mercy of geopolitics. But as a state, in my experience, the state really hasn't understood the federal program, understood the benefits that people offer, understood the status they're being given. We don't have that muscle. And the reality is, if we did, we could do something in our state that was more equitable, that treated people more fairly, that had more supports, and more protections. And that's really, I think, where we need to be now. We need to I think work authorization is huge, and Maura Healey's been really, really pushing for it. I think giving hundreds of thousands of Venezuelans this means we can do that, right? Advocacy works. That works. So we have to push for that. But at the same time, our state could be just an amazing place for a new person. And that wouldn't completely depend on the federal government. We could recognize all the inequities and do something to sort of manage how we treat people. So I know we're going to get into the conversation about resources in a minute, but that's where I think we're at. If we have the will and the resources, we could solve some of these challenges and treat people more equitably. And of course, as we all know, the tiny little bit we give someone gets returned over and over and over again throughout their lifetime, throughout generations. We're here because of that return. So, I don't think there's any more important investment.
In terms of opportunities and barriers, just one thing to note too is that I think that the state has had a mindset, because of this concept of being a right to shelter state, that's what we're going to provide people. We're going to provide people with shelter because we don't have an obligation. We don't have a right to housing. We don't have a right to other basic needs. And so when we have that as our view and as our goal, just providing shelter, we've seen the state scramble to bring on motel units and temporary shelters to be able to meet that demand. Historically, we've also seen the state delay applications or illegally deny families because of the demand, because they didn't have the units to match up. So we're grateful that the state is acknowledging the scope of the issue, trying to bring on new units, but that can't only be the goal. And we've also seen historically, the goal is to shut down the motels, to reduce the numbers of families in shelter. But really, it's can we have the goal to make sure that people are safe and healthy, stabilized, contributing, happy? And so if we are only focused on this right to shelter, we're failing as a larger community. And so I hope that we can shift the narrative as this opportunity of we can't even provide that right to shelter, protect it, and to do that, but make sure that that's not our ultimate goal, that really it is for that longer term stability and decreasing the trauma that children are facing based on the current system and what we're providing and not providing.
That's great. Yeah, thank you so much. I think, again, speaking to higher aspirations for all of us, right? As individuals, as communities, as a Commonwealth. So let's talk about resourcing. We have here 4 great organizations that are representatives of obviously a number of great organizations across the county and across the state who are doing, again, all they can to meet this moment. We know that if you were resourced appropriately, abundantly, we can actually move us away from crisis and into opportunity more quickly. And that's both individually and in connection and collaboration with one another. But we also know, as was pointed out earlier by Alexandra, that there are so many challenges with funding, the way it's structured, not just private and philanthropic, but also public, state and federal, that's had negative impacts on this work. So, you are in a room of folks who I think are called to do something. And we would love to hear from you directly how we as donors, nonprofit partners, advocates, and community members can best support you, our newly arrived families and individuals, and also others who are experiencing housing insecurity.
You want to go first, Caroline?
Absolutely. So I think that the best way that you can support is continue to advocate. Also, volunteering is critical right now. There's a lot of work that needs to be done. And I know that we thrive on volunteering, even though there's a lot of, we like to query people before they come to our shelters, just because that's kind of like what we have to do by law. But we are open to volunteering. There's other things that you can do, like help us serve meals, donating to organizations that are providing services to these families is also critical. We depend on donations to be able to continue to provide the level of services and care that we provide, and for additional expenses that we are seeing coming along the way, like what we were just talking about. Now we have to figure out how we're gonna get these people to their appointments, making sure that they comply with whatever it is that they need. If you have your skill and talent, if you're an immigration lawyer, if you have any skill or talent, we want you. We want to know from you. Please do send me an email. Send us an email saying, hey, I'm an HR official, or hey, I train, or hey, I know that I see a lot of familiar people in this call that are working actively with us to, for this step-by-step process. We can move quickly to the other side, but every step we take, we have to make sure that we have all our partners with us. So once we can speed, we have them in place. I see Brigitta from Leo, I see Eliu Alcala from, all of these people are our supportive backbone and really helping us through with figuring this out as we go along. And just, I think that the power of collectiveness is unmeasurable. And I think that at this point, that's what we need to do. We need to unify our voices and make sure that we are all advocating for the same things for migrant families and for homeless families. I think that when we start diluting messages and everybody has their own agenda is when administrations get really flustered and confused. But if we have a collective message, then we can get things done. I agree with Kelly. I think that we just need to make sure that everybody feels that they have the right to shelter, that everybody feels that they should be protected, that they should receive the services that we can provide, that nobody feels left behind in this journey. So that will be on my end.
And for us right now, we are literally working with 42 different hotels and shelters all across the state. And those 42, the reason why we are working with them is because they were not staff. In general, before you send family to a shelter or to a hotel, there will be a provider. And the role of the provider will be to assist the families, helping with that integration process that I've been talking about. Unfortunately, given the nature of the emergency, so people were placed in so many different municipalities with no support whatsoever. So what I said to the state is that this is a unique opportunity for us to do something very positive and good. So the first thing we said, we're going to go to the communities where the hotel and shelters are. We're going to identify partners, whether or not it's a church, whether or not it's a community-based organization, or a Y, whatever it is, we're going to identify them to really partner with us so that we can be there to assist families. So right now, we said, if we were to be able to at least have 3 staff that we can allocate in all of those places, just to be able to help families, with their medical appointments. Transportation is a very big, believe it or not, very big challenge that they are facing because they are so far away. They don't know exactly how to get to their medical appointment, especially if they started in Boston, for example. They were at Boston Medical Center, and here they are all the way, you see, I mean, in the North Shore, in Essex, wherever they are. Transportation is a big issue. Food is another big issue. Unfortunately, as you can imagine, given the state lack of readiness for the crisis, the food that they are providing to the families is so not, their typical food. So pregnant women are saying that they cannot even take their medicine. They send them frozen food. There's no microwave. There's no kitchen. So they cannot even eat them. So again, we are partnering with others in the area so that we can at least have some more meals to send their way. They need to do all of their paperwork. For example, now that they say that they're going to help, expedite work authorization, but for them to have access to that work authorization, we need to put the application in. And when they are so far removed and they don't have anyone to help them, they cannot even apply for the work authorization. So we need to send people to the shelters, help them do their work authorization, help them apply for myself, help them, go to their medical appointment, change of venue, what Carolina was talking about. For example, when they come, sometimes they came with the idea that they were going to be in San Antonio. And then for some reason, someone paid a ticket for them, and then they find themselves in Boston. They have no clue of where they are. In their mind, they are in San Antonio, when in fact they are in Boston. So they cannot miss their court appointment. So we need to quickly do this change of venue, application for them to say, no, they are no longer going to San Antonio because now they are in Boston. So a number of things that need to happen really quickly. And unfortunately, because we do not have the resources to send most of the people to the hotel on a timely basis, they are losing on their appointment. And as you know, the court system here, if you miss an appointment, you can be deported. So that's the reason we need to really move fast to be in those hotels and shelters. So I'm talking typically about those who are here at very high risk, not having any point of reference. But as Carolina said, we have a lot of people who have been here who are waiting to really access the services too. But I'm talking right now, my head is like immediate. They are here. They have children. On Tuesday, we went to a hotel, 7 month pregnancy, no medical appointment whatsoever. Have never seen any doctor, and she's 7 months pregnant. So we cannot afford to leave that lady, and then because she doesn't have transportation, she doesn't know what to do. So we need to take that lady to the doctor's appointment ASAP. Children need to go to school. They cannot get access to their immunization record because they came with nothing. So again, there are those urgent things that we need to deal ASAP. And if there is a request that I will put out there is for really the philanthropic community to really stand with us to at least quickly respond to those immediate needs while we are building the capacity for the long term. Because if you don't have the baby step 1 and 2, you cannot even think about 4 and 5. You see what I mean? So those are the things that we will need to continue the advocacy. We will need to continue with the volunteering, but we need those things to be done ASAP. Thank you.
Great. I see your hand, Alexandra.
Yeah, thanks. I totally agree. I think that the state is completely relying on their providers that they may or may not fund to support this crisis. And they might be super, super laser focused on shelter because that's the law. But there's just, like Dr. Gabot said, so much more involved. And for so many people now, they have a military person in the shelter to provide them with everything, where they're at, what they need if they're 7 months pregnant. Like, it's wild. And I'm very frustrated with the state's process for delivering supplemental funds. They typically do it through the Department of Livable Communities or the Office for Refugees and Immigrants. It goes really slowly. We just we do legal services and case management services. We're hoping to do ESOL and employment for it's about 8 shelters now. We have about 6,000 people in our services, we've helped apply for federal benefits that are mostly people without children that can apply through those benefits. But we're all standing up teams to support all these people in every type of shelter. And we just got a contract the other day, and it offers 0.8 FTE for an attorney and 0.4 FTE for a paralegal and 0.2 FTE for a supervisor. That is not that means what they're saying is you should probably violate employment law, because you're going to need to take an existing person and they're going to need to work 1,000 extra hours, which you can't fund. It's really a very complicated challenge, but I think the ability to understand, Maura Healey just announced wanting $250 million to flow through the state for the shelter and support program. We're just really worried that not a lot of that money comes actually to the organizations that do that feed people, that really do that work. And as donors, I think if you could send in $5, send in $10, like these things add up. And it's really about everyone contributing even a little bit to just make sure that people who are on the ground are not going to sleep at night if someone's going hungry, have someone there to feed them. So, I really appreciate and think advocacy is huge. And this is actually how we get the state resources, which we all need. We can't do this without it, to the right organizations. But I also think there's a whole huge component that will never be covered through public funding that is a philanthropic investment. And, that's really where I think a lot of our work is. If you want to volunteer and you want to connect, also fund a volunteer coordinator, or fund a part of it. Just realize every single thing that we do with our communities also takes a person for us to support. Our organization, we like to pay people living wages, so we have 177 funding streams here. Most of them are highly restricted. And that just means that there's just, money going into these little buckets and then no money for the other 0.4 FTE that you need to actually pay someone. So I would say, think about donating, and also stay involved, and please continue to advocate, because you can make a difference at the state level.
Absolutely.
Yeah, thank you for that. I think just want to add a little something to what you added there in terms of the role of private philanthropy, right? There is an opportunity when we see these, notes of either state, federal funding, there are so many restrictions to that, as you've already heard, right? And so this is where flexible, ongoing support from philanthropy can be helpful, can be more responsive, can, get to folks more quickly, potentially, when state contracts need to be approved over a number of months, right? So there is a role for us to play as well. Kelly, did you want to add to this conversation?
Yeah, thanks. So building on what Zan was saying, around the supplemental budget request from Governor Healey. So, we think it's really important for people to be informed and engaged and kind and compassionate, but also really doing that advocacy work, being in conversation with elected officials. They're hearing a lot from the business community, from constituents that may be at odds with what we're saying here and what the values are in this conversation. And so, the governor has requested $250 million, $130 million of that would go directly to support shelters, the Emergency Assistance Family Shelter Program, $33 million to support temporary shelter sites. There's one right now at Joint Base Cape Cod and at Eastern Nazarene College. And then $87 million for wraparound services, including legal supports, medical supports, funds for school districts that are seeing more students come in. But that's just the first request. So that's what the governor's proposing. But what comes out of the legislature could be very different. It could incorporate some of the vision and the ideas that we're talking about today. And so that bill is waiting action in the House Committee on Ways and Means. And so we'll be sending out an action alert next week to talk about having those conversations with legislators. How can we use this as an opportunity to move the state closer to better supporting families and individuals who are new arrivals, who are experiencing housing instability and homelessness? Because the state has unprecedented funds. There still are funds remaining from the American Rescue Plan Act, the ARPA funds that can be used. There's money in the state's rainy day fund. There's resources coming in just through regular tax revenues, that we're not at a loss for funding right now, and we're not at a loss for good ideas. As we've talked about today, we know a lot of the steps that we need to take, but being in conversation, in particular in this case with state legislators, with your state senator, your state representative, talking about the importance of passing these funds quickly to make sure that the funds are flexible, that they can get out to community-based groups and be used immediately, and that they're not caught up in the bureaucracy because people can't wait. And so I'll stick my email in the chat, but if anybody's interested in getting involved on the policy advocacy side or being added to our email list, we would love to have you. And for example, at 10 o'clock, we're co-hosting a meeting with Citizens Housing and Planning Association and Mass Law Reform Institute to talk about the further making recommendations on the housing response to help families exit shelter. But we're convening working groups. We're part of larger groups through Mura Coalition and others that are having these conversations. So definitely reach out if you're interested in being more involved at that level. Thank you.
Yeah, thank you. Again, like not just the dollars, there's also other ways that you can be involved and contribute in really powerful ways, right? Advocacy can ultimately move legislation that can really impact a lot of people, even beyond the scope of dollars that private philanthropy can provide. So I think we may be shifting into audience questions. Stacey, do I have that right?
Yeah, there's been a lot here. If you're like me, I have like 16 pages of notes right now. And so it might take a moment to reflect on what you've heard or what you might be still wondering from any one of our speakers. So does anybody have anything that they want to just raise their hand for, to ask a question of either the entire group or anybody in particular? Happy to take a hand if anybody wants to. And just as a quick note, thank you, Kelly and Dr. Gabo, for adding your emails here. We will follow up with everybody on this call with information about how to get involved or how to stay connected, and sharing the contact information with everybody as well. There's been certainly some real calls to action here. So Heidi, do you want to go ahead and ask your question?
Yeah, hi, thanks. So Heidi Ellard with ECCF Donor Engagement. I was just wondering if you could give us a little bit more of a perspective on the budgets that you all work with within your organizations. You had mentioned earlier the federal and state governments provide you guys with some budgeting, but I was wondering if you could share with us how much a role philanthropy does play in actually being able to deliver the work that you're doing and really filling the gaps that some of those restricted funds might have.
I can start. So like I mentioned, we have 177 funding streams. They're federal and they're state, they're local, they're municipal. We rely on about 1/3 of our budget to cover all of our operating expenses each year. So we have, I think this year, I'm just finishing it, $21 million budget, 15 million will come from state and federal and public resources. My goal for development and advancement work is 6.1 million. And that's to cover what we're doing now. It's not to, as we move forward, I think what I like to say is every 3 public dollars requires a private dollar for us. So to the extent that we continue to get public funding, we need more and more private funding. And the structure of the program is called, it's like a VOLAG program. It's called voluntary organizations because these programs were developed in the 1980s. They were developed by the federal and state government to have a voluntary component to them, to rely on communities to be able to support the entire cost of programming. So I would say that was a mistake because if we're spending all our time fundraising, how are we building our communities? But at the same time, it does bring us into relationship with our community and sort of doesn't leave the community behind when it comes to actually like working with people and integrating them.
I think that just to add to the importance of philanthropic dollars, I think that when you have funding that's coming through the state and that's coming through federal and that's coming through different piles of institutional money, there's a lot of restrictions on how you can use that money. And for a lot of people, every family has a very defined set of needs, and needs that sometimes are not covered in the way that we would want to cover to address all of the different things. Families go through different iterations of things, and sometimes we can only support once of that iteration of things if you're moving them out and they're back into so you can't do that. Like someone was talking about, there are different components and requirements of how you can use that money. So that's when private dollars come really handy, to really plug in the additional supportive services that these families need in order to not go back to either homelessness or different ways of kind of like having all the challenges that they have, or to provide the additional support to stabilize them, like additional mental health therapy, or getting them immersed in the community. Sometimes transportation is the issue, making sure that they can be able to go from point A to point B. And sometimes that money is limited and restricted, or you can only use it for this thing but not for that thing. If they can't use it every day, but you have to go to work every day. And then in a city like Peabody, public transportation is a challenge. So how do you get people to work every day when they can only use this amount of money, and they can't pay out of pocket because it's a lot of money. So I think that those are the little nuggets that private funding do come and help alleviate organizations, nonprofit organizations.
I'll just say one other thing. The
organization.
oh, sorry, Carolyn. Go ahead.
Yeah. The part of the food insecurity part of my organization is 100% fundraised for. So we work with the support of the Greater Boston Food Bank, but also salaries, community meals, everything else. All of the operation is fundraised for. So in order to continue to provide food for our people, we need to make sure that we have enough money that we fundraise to be able to do that. So I think that that's, it is part of our reality, and we have strong, pretty steep fundraising goals. So every cent counts. There's no minimal investment. I think that in order to continue to provide services to our communities, all nonprofits need the private monies that allow us to operate.
I was just going to say one more thing, that more and more of our private dollars, and this is probably true for all my colleagues, are going to support this inequity. So like if we have, a Haitian arrival, they may have access to some federal benefits. If they're from Nicaragua, they won't. There's so many inequities in immigration law that create that direct impacts on what people are actually able to receive in terms of food and shelter. And that's another whole huge piece of how unrestricted or basically philanthropic dollars can help us make our services more equitable.
Mary, go ahead and ask your question.
Yes, thank you so much. And thank you for hosting this session. It's great to hear all these perspectives on this huge crisis / opportunity that we have right here in Massachusetts. I just wanted to speak for MassHire, and I know there are several MassHire folks on this call right now. But one of the issues that we struggle with is that we have lots of money for training, but we cannot train people who are not work authorized. And that's one of those laws that exist both at the federal and state level, well-intentioned in the sense that our role is to get people to work. And therefore the work authorization is important. But what for me, the irony is that once you're work authorized, then you have to go to training, and then it takes a while to get into an employment situation, even if you're just brushing up on existing skills that you've had in your home country. And so we're trying to advocate for a change in those rules to allow us to start training you know, and I'm willing to give on this a little, of course, as soon as you have applied for work authorization, because we know that takes about a year, sometimes maybe longer, to make it through the system. So if somebody has an open application for a work authorization, we would like to be able to enroll them in training programs. So any help or thoughts that people have on that, it is a part of the federal legislation. You have to be able to work in the US to be served by us. And we can certainly help people informally and inform what's going on and keep them on a track. But to do that all important training, you have to be work authorized. And we would just like to get a waiver from that rule by both the state and the federal government to help us start that project. So thank you again for having this session.
And that's exactly what we are working on, Mary, in terms of, you know, what I was talking to the governor, and I said, we need what we call an active waiting time for our population. What I mean by an active waiting time, while they are waiting for their work authorization, things need to happen. Because if we have to wait for the work authorization to come, which could be anything between 6 months to a year, and then for them to go to the training, and then for them to go to work. So they are basically wasting only almost a year in their life just to be in the wait. So I said, as soon as they have their documents and then they can apply for that work authorization, let's use that as a way for them to get them into, you know, different trainings or different things that they need to have, even though they have to probably wait for that work authorization to come to finalize it, but at least allow those resources to come. And that's one of the sad things that we are experiencing. It's not that we don't have resources. It's just that there are so many, you know, rules, regulations, and, you know, restrictions that those resources cannot go to our families. Just to give you an example, for example, yesterday or the day before, I was in a heated conversation with the state. We submitted a budget to be able to do all of the work as I was telling you. And then they called us, they said that they want to give us 1/10 of the budget. And I'm like, okay, so I ask you, and you see the work, you know what we are doing. And then when you give me 1/10, what exactly do you want me to do with that 10? So at some point, I have to tell them, you know what? I know I am not going to worry about you, because if I have, those families are in need of immediate, urgent, you know, services, we are going to do whatever it takes. And that's one of the reasons I have to say that. I always say that because, you know, when you are called to do something, you see, I mean, you know, God will provide. So that's the mentality that I had to embrace, because if I have to fight with them every day to get resources, I am not going to be able to do the work. And that's the reason why I really, every time someone out of the blue send me an email, Dr. Gabo, how can we help? And I'm like, you know what? That's how God answers my prayer. I don't have to worry fighting about I am not saying that we should not fight. We should, but there is those urgent needs that we need to address ASAP. So to me, your presence, your contribution, your support means so much to us, while this bureaucracy, all of those things are going here, at least for us to make sure that families have access to at least basic services. So again, just so that you know, whatever you do, it's not little. It's good, because every single one penny add together to allow us to really serve, while advocacy is going on the other hand to fight against the bureaucracy. We cannot wait. Those families cannot wait. Those babies, like yesterday, I had to fight to send a crib to a shelter because a newborn, 3 weeks old, is sleeping in the same bed with mom and dad. So I said, let's send a crib, because at any given time, there could be a rollover, and then before we know it, it's another disaster. So those are the immediate things that are happening right now that we cannot wait for bureaucracy to help us solve. And that's the reason why we said, no matter what, I said, you know, you give me resources, fine. You don't give me, guess what? No matter what, we're going to serve, because that's our job, to serve, not to really deal with you. So that's our mentality, and I agree with all ideas that could really help bring resources immediately to the families, as we are thinking in terms of intermediate and long term. Thank you.
I'm going to use that term, acting waiting period. I'm going to use that from now on. Thank you.
Yeah.
I know.
And Mary, that is one of the biggest contradictions that we see in our system. We
Yes.
want people to be independent, but we hold them. We
Mhm,
want people to pull themselves by the bootstraps, but we don't allow them to work. We
mhm.
want people to go back into the workforce, but we don't train them. But yeah, we have a shortage of labor in the state. So those are the biggest contradictions that we need to politically and administratively change in order for people to get to where they need to go. And I think that, we've been very vocal with Governor Healy from the council, kind of like really putting forward these concerns and these contradictions. Because like Dr. Gabel was saying, we're going to do the work anyway. But there's a lot of roads that are easier to navigate than the ones that we commonly have to take as nonprofits to fulfill the needs of the community that are present and imminent. That is the end of at the end of the day, we're going to do the work no matter what. But there are so many other ways that are easier, and there's funding there that we can access if there wasn't so many regulations. So,
And it's funny because I've never said, when I tell people, we're just random people that yes, there's a lot of migrants, they are in shelter, we can't train them or put them to work because they're not work authorized. There's not a person in the world that says that's the stupidest thing I've ever heard.
Mm.
These folks want to work, they're
Mhm.
ready to, their minds are working in that way. No one says it's a good idea to not let them work. That's so ironic
Yeah.
that we can't
but then
make that
we demonize them for taking from the system.
which is
We demonize them for requiring assistance.
Right.
We demonize them and we badmouth them, and we have all this anti-immigrant sentiment, and we continue to blame them for whatever mishap we have in our budget.
right.
So, I think that these are the narratives that we really need to emphasize and put just make sure that we're telling people the story as it is.
Yeah,
Right.
and that's why these conversations are so important, right? Because it gets to the actual heart of the matter, right? And we started this conversation by reminding ourselves that proximity equals expertise, and that community has the power to make change. And I think over the last hour plus, we've seen and heard that in droves, right? And that is what these spaces are exactly about. So I'm looking at the time. I promised I would get everybody out of here by 10. So I'm just going to wrap up really quickly if you'll hang with me. So I think again, like I said, I have about 17 pages of notes. I've seen a lot of nodding heads. I've seen other people writing things down. There's been some comments. I just stand in absolute awe and gratitude for the passion, the expertise, the intelligence that Dr. Gabot, that Carolina, that Zan, that Kelly are bringing to the table, not just in this conversation, but in the day-to-day. I mean, the work that they are doing and the people that they're helping. I truly thank you. Doesn't begin to cover it, not just for your time today, but for all of it. And I'm going to, paraphrase Zan. I wrote this down, like, if we have the will and the resources, we can really do something different in Massachusetts. And then I look around at who's on this call, and it's we, the community. We have the resources. We have the will collectively. And that's really the call that I hope that you're hearing loud and clear today, regardless of whether you're representing an organization or yourself or a town or whatever that is. In gratitude for, again, not just the work you're doing all the time, but also to just show you that as a community foundation, we value the time and effort that you gave to us today, that you gave all of us today in sharing. ECCF is going to be making a gift to each of your organizations to just recognize that your time is valuable, and that we as, the donor community, as the community at large, can act in that way and show gratitude through our giving. So thank you. And you can expect that pretty soon.
Thank you so much.
Absolutely. I also think that it's time, leaving a conversation like this, we sort of say, now what, right? Or what do we do with this? ECCF is here to help you. This is our role as a community foundation. So in just a minute, I'm going to drop in this chat here. Maybe I can just even do it right now. We created a website, a page on our website that has the names of organizations that are working to address, all elements of the system here in Essex County. So we invite you to visit that page. We invite you to find the organizations that speak to you, to see what they need, to keep asking questions. I heard that advocacy matters. I heard that giving matters. I hear that, you know, talking to your neighbors to, you know, change the narratives that we're hearing, all of that matters. So I hope that you leave here today just feeling this sense of connection, of action, and maybe even just join me a little bit of awe and gratitude to these folks. So please reach out to the Community Foundation. We're here to help you navigate your way through this as you find your action. And I hope that you'll connect with each other too. We'll follow with an email as well. So thank you all very, very much for your time and for everything. Thank you. Thank you, Hershey. You're amazing.
Thank you. That was
Thank you so
wonderful.
much.
Thank you. I appreciate it.
Thanks, everyone. Thanks, ECF.
Thank you, everybody.
Thanks, everyone.
Take
Hey,
care.
everybody.